For the first time globally, a standard set of drugs, especially designed by World Health Organization for inpatient management of severe acute malnutrition, known as SAMKIT, is made available to allow fast-track procurement of standard pre-packed kits ready to be quickly dispatched in emergency.
In 2016, South Sudan was the first country to introduce the SAM kits, and the first 20 kits were assembled in the Juba warehouse and distributed across country. In 2017, we also distributed 90 kits, so we scaled up the number of kits distributed in stabilization centers. For this year, in 2018, we have already distributed 25 kits, and we have secured other 70 kits to support the stabilization centers.
WHO South Sudan has identified the provision of the drug kit as key strategy to support stabilization centers to manage severely acute malnourished children with medical complications, thus tackling severe acute malnutrition and reducing associated morbidity and mortality. The SAM kit will enable the Ministry of Health and partners operating the stabilization centers to be autonomous in providing a comprehensive quality and life-saving treatment for inpatients. It will, in addition, provide a stopgap measure for hospital stock of medicines.
So the SAM kits is part of the WHO emergency core pipeline, and as such is meant to be a measure to close the gaps in terms of supplies. And we distribute the kits mainly focusing on stabilization center who are reporting shortages in supplies.
The kit contains the most essential medicines for treatment of children with severe acute malnutrition and medical complications. The content constitutes 4 basic modules of routine, basic, supplementary, and malaria drugs.
One kit can provide the treatment for 50 children with severe acute malnutrition and medical complications. And WHO distributes these kits to stabilization centers across country.
Severely malnourished children with medical complications are those at highest risk of death and do not respond to medical treatments as their well-nourished counterparts do. Children with severe acute malnutrition who have medical complication should be treated in stabilization centers where inpatient medical and nutritional care is provided. Availability of core drugs will be a decisive condition for sustainability of life-saving nutrition services in the most affected areas. Despite the fragile security situation and challenging conditions to deliver health and nutrition services, WHO, in partnership with the Ministry of Health and partners, continue to work at improving access to severe acute malnutrition treatment services. Recent efforts included provision of essential medicines to stabilization centers, developing national guidelines, conducting capacity building programs, and performing ongoing disease surveillance and monitoring.
So in collaboration with WHO Health Information Team, we have already established over 25 Sentinel sites in key priority locations, and this will help us in generating weekly data on MUAC screening and also to raise alerts in case we find any very abnormal rate of global acute malnutrition, and of course to trigger rapid response.
In an effort to close child survival gaps, World Health Organization, in collaboration with the Nutrition Cluster, is providing comprehensive training of trainers on management of severe acute malnutrition with medical complications, water quality control system, psychological support to caretakers of admitted children, and monitoring as well as supporting functionality and quality of stabilization center services in all the states of South Sudan.